first bring back your nitrous machine from the dispensary, this is what you'll see. First thing we want to do is hook up the scavenging line. So you'll get a high volume suction tip. Your scavenging line is going to be this gray line. So insert your high volume suction tip into the gray line, and then insert the other end of that high volume suction tip into the high volume suction. To turn on the scavenging line, all you're going to do is turn on your high volume suction, just enough so that the dial right here is within the green. Once you have that, the next step is to set up your patient's mask, which I have here. So take it out of the bag. This end is going to go here, and then this other end is going to go around your patient's nose. These two little tubes are then inserted through these holes and will go in your patient's nostrils. This is the orientation for which this will be placed on your patient's face. So we'll come over here to the patient. Before placing this on your patient's face, we'll stretch this accordion style tube out and place it, hook it up to the end of this white tube. Okay? The nose piece then goes on your patient's face to cover their nose so that the strap fits comfortably without impinging upon the tube going to the waste gas line. Okay? Once you have all that and situated on the patient's face, make sure these tubes that go in the patient's nostril are in the correct position. And you can ask your patient if those tubes are comfortably in their nostrils. The next step will be to unlock the nitrogen and oxygen canisters. Nitrogen is in the blue canister, whereas oxygen is in the green canister. So we'll use this key and turn it all the way to the left. Okay, same for the oxygen. Okay. Keep in mind that when looking at the PSI for both oxygen and nitrogen, the oxygen will accurately tell you how much oxygen is left in the tank, whereas the reading for the nitrous will not. Okay? So now that we've unlocked the nitrous and the oxygen, turn this dial to the left to the point where this silver ball is between 5 and 6 for adults. And at this point, we are emitting 100% oxygen in through the patient's nose. From here, we want to titrate up and slowly increase the amount of nitrous outflowing. So now we're at 0, and as we slowly turn this dial down, we're titrating the nitrous up. Now we're at 80% oxygen and 20% nitrous. And we want to continue that until we get to the point where we're at the desired level of nitrous to start your procedure. At the end of the procedure, we're going to quickly bring the patient back down to 100% oxygen, and very importantly, make sure to leave your patient with 100% oxygen for 5 minutes before removing the facial mask to inhibit diffusion hypoxia.